Today I wanted to get more into my mental health background as a therapist and talk a little bit about the role of neurotransmitters in the development of mental health issues, specifically depression. And I was encouraged and kind of motivated to talk a little bit more about this and research it because I was going through and donating some old books. And I came across a book that I remember reading, a long time ago, I think in undergrad. And I was curious. I really liked the book at the time. It was a more of a holistic approach to mental health. And I was really curious, what has happened since then on the newer research. And so this book was called Natural Prozac, and it was written by Joel Robertson. And I remember reading it back probably around 2008. I think it was written a little bit before that. And his hypothesis was that different types of depression are related to imbalances of specific neurotransmitters. And I kind of made a synopsis of what his book talked about, and then I'll go a little bit more into what we know from current research. But I find this theory really interesting because we do know that they have kind of disproven the serotonin only hypothesis for depression. And we also know that depression presents in different ways in different people. So in a kind of recap, the Natural Prozac book, he talks about serotonin deficiency depression, neuroepinephrine deficiency depression, and dopamine deficiency depression. And the theory was that serotonin deficiency depression looks like feelings of sadness and low self-esteem and guilt and irritability, sleep disturbances, and that this deficiency in serotonin leads to depressive symptoms for these specific people because serotonin is known for its role in mood regulation and sleep and appetite. Then with norepinephrine deficiency depression, you're going to see more fatigue, lack of motivation, difficulty concentrating, and reduced interest because low levels of norepinephrine result in that lack of energy and motivation, which can contribute to depression in a different way. And we need norepinephrine for alertness and energy and attention. Whereas the dopamine deficiency depression is more presented with that anhedonia, that inability to feel anything, to feel pleasure, to lack of interest in anything and reduced drive and really just seeking out pleasure-seeking behavior. So dopamine deficiency depression people might be the ones more prone to just seeking out comfort and almost like binge eating and sleeping all day, or maybe even with self-harm urges. And so that's because dopamine is associated with reward and motivation and pleasure. So the book was really interesting because I love holistic, treatments and care, and I loved that it was deviating from this standard idea that SSRIs or serotonin-driven treatment and pharmaceutical-driven treatment is the answer to everything, right? So in this book, depending on where you felt you scored as far as what type of depression you potentially had, the treatment recommendations consisted of diet, right? So if there's serotonin deficiency, we want to increase foods rich in tryptophan, which is a precursor to serotonin. That's why 5-HTP as a supplement, 5-hydroxytryptophan as a supplement is something that can be helpful for serotonin boost. Foods might be like turkey and milk and eggs and nuts. For norepinephrine, foods that support that production, like lean proteins, bananas, almonds. For dopamine, things high in tyrosine, which is a precursor to dopamine production, so chicken, avocados, dairy. Regular exercise, which can boost the levels of all of these neurotransmitters, specifically aerobic exercise. And the supplements for serotonin, like we said, 5-HTP, St. John's wort, for norepinephrine, rhodiola or ginseng, and for dopamine, supplements like L-tyrosine. It's just really interesting to think of some of these more dietary and supplement-based ways to beef up these neurotransmitters that may be deficient. And there actually are several lines of research to support some of these hypotheses. So a lot of studies have shown that low levels of serotonin are associated with depressive symptoms, and SSRIs are a common treatment for depression. SSRI is a selective serotonin reuptake inhibitor. So as the serotonin, the hypothesis on this, right, is as the serotonin is circulating in your brain, this medication is slowing down the receptors that reuptake that serotonin. So it's supposed to leave more of it circulating, and that's supposed to help boost mood. There's also been genetic studies in variations of serotonin transporter genes that are linked to this increased risk for depression, which kind of further supports that role of serotonin in the depression process. Now, there's also have been studies on the norepinephrine levels with depression, and there are different antidepressants, SNRIs, which are selective norepinephrine reuptake inhibitors, NRIs, and the ones that act on both serotonin and norepinephrine. And those can be helpful for alleviating depression as well, which is interesting because now we're seeing that some people react better to an SNRI than just an SSRI. And norepinephrine is important for attention and ability to have energy and arousal and energy. So it makes sense that this is linked to our energy levels, fatigue, concentration. And lastly, with dopamine, we need dopamine for our brain's reward system. Dopamine has also been linked to addiction and addictive behaviors. And not enough dopamine can be linked to this lack of ability to care about things, anhedonia, where you just can't find the joy in things you used to like. And there are medications to enhance dopamine function, like NDRIs, which can also be effective for depression. So the more we look at this, though, I find it really interesting because we want to look at all the different ways that we can best handle and approach and help ourselves when we're dealing with any of these types of depression or any sort of mood imbalance. And this also relates to brain retraining. I also find it really interesting as a therapist, why are some of my clients, when they're depressed or anxious, more inclined to different types of activities? Why, when some people are depressed, do they want to lay around on the couch and binge watch TV and binge eat junk food? And other people are kind of becoming more reckless, or they're thrill seeking, or they want to engage in behaviors that technically are causing some sort of harm because it makes them feel something. And this, I think, relates to this neurotransmitter theory in a different way. So when I think about like adrenaline and dopamine, you think about adrenaline seekers, people who are drawn to high adrenaline activities. And I think about like CrossFitters and ice bath people. A lot of these people are looking to balance out their neurotransmitters. You feel better because these activities temporarily increase a release of endorphins and neurotransmitters. You get a rush of excitement or focus or energy. And the thrill and challenge of these activities gives you a release of adrenaline, epinephrine, and dopamine, which helps us to improve mood and that sense of accomplishment and pleasure. So over time, that's also linked to the dopamine response in our brain. Where we can get into a sticky situation here is we have to be encouraging people to channel this desire to have this adrenaline rush from healthy, safe activities. I think that some people don't realize that this adrenaline rush can be healthy to balance our neurotransmitters, but they're seeking this adrenaline rush from unhealthy activities. And conversely, people who are looking for the more soothing, calming issues with these dopamine or serotonin imbalances, this looking for, doom scrolling or binge eating or just wanting comfort or sleep, hypersomnia, you're seeking immediate comfort, temporary kind of pleasure and reward, quick dopamine hits. How do we work on developing a more overall sense of calm and peace with practices like maybe mindfulness, yoga, breath work, having structure in your day, having built-in reward systems within structure so that you're not feeling it has to be all or nothing? And what I really want to kind of zero in on here is how brain retraining can play a role in this when we're working on healing. And knowing what kind of activities are going to be the healthiest to help us find this balance here. And what I think is really interesting is some of the newer research that talks about dopamine and motivation. We know that dopamine plays this crucial role in our motivation and reward system. And some recent studies showed that dopamine neurons in the ventral tegmental area are linked to motivation and can be influenced by brain inflammation, which might suppress dopamine and decrease motivation. And this is really interesting because chronic stress, chronic cortisol, chronic fight or flight mode in our limbic system can lead to brain inflammation, chronic illness, chronic infections, things that we talk about all the time here like Lyme and strep and pandas and things that can lead to brain inflammation can then later on lead to a physiological reason that you may be feeling depressed. If we look at physical activities and supplements that could support the release of dopamine, this can help our overall mood and mental health and functioning. And dopamine producing neurons often express receptors for serotonin. So these serotonin based neurons influence the dopamine and vice versa. So there's an interplay between these. So some of this newer research is telling us that it's not as clear cut as just focusing on one neurotransmitter at a time, which we've done a lot in Western medicine and pharmaceutical medicine. There's an interplay between the neurotransmitters and how they impact each other. When we look at brain retraining and limbic system regulation and calming activities and that effect on serotonin, when we're doing mindfulness and meditation and positive psychology, serotonin is really crucial for stabilizing our mood. Serotonin-based neurons can influence behaviors, which then are related to our mood. So the serotonin circuits in the prefrontal cortex are very pivotal for our anxiety and depression expression. And mindfulness, we know, can help regulate our limbic system, but it also increases serotonin levels. So that's part of the reason we feel more relaxed and more stable. And what's interesting about this is it also goes back to cognitive behavior therapy. We think differently, which leads to different behaviors and more structure, and that changes our overall mood and our ability to engage in activities and with the world around us. I think that this is all very interesting because it all interplays together. And what I want to talk about is this idea of how often people in the chronic pain and chronic illness community are sent to psych. We get labeled as it's depression, it's anxiety. Have you thought about this could all be in your head, right? We are finding more and more every day that there are biological, neurotransmitter, neurochemical reasons for depression, for anxiety, and they all connect with each other. So if I have pain or illness or inflammation, and I'm going to actually talk a little bit about, brain inflammation as well, but over time, being in pain, having chronic illness, it can impact our neurotransmitters and lead to feelings of depression or anxiety. Just like situationally, living with a chronic illness or chronic pain can make you feel depressed because you just don't feel good about your life. And so I think that the brain retraining pieces where we're finding the joy, we're redirecting the thoughts, we're working on the cognitive side, we're changing the behaviors, it's one part of unlocking this puzzle. But we also should be very aware of what we're doing physically to support our bodies and to support our neurotransmitters and to support deeper healing and uncover different root causes, because they are all always constantly in this cycle of one thing triggering the next. There was a study done recently where researchers were challenging the serotonin hypothesis, and the review kind of was highlighting that antidepressants, even though they do affect serotonin levels, it doesn't always mean that serotonin imbalance alone is the root cause of depression. And so it's interesting because we're seeing that there are more factors at play. And this is why it's good to question not just being on an antidepressant to solve all of your problems, even though it can be very helpful, but looking at the more robust, bigger picture. There have been some studies looking at the Nucleus accumbens, which is part of the brain's pleasure circuit, and its role in this ability to feel pleasure. So chronic stress can elevate melanocortin levels, which then reduces this Nucleus accumbens' ability to experience pleasure. So this research is suggesting that depression can be linked to disruption in the brain's reward circuitry rather than just the specific serotonin hypothesis. There was also a neuroscientist, Dr. Robert Malenka, and he emphasized that the brain's neurotransmitters influence circuits in multiple ways. So rather than just a chemical imbalance, depression also involves different brain regions and circuits. So we shift this focus from individual transmitters to how different areas of the brain contribute to mood symptoms. which we understand from the amygdala, the HPA axis, the fight or flight mode, the limbic system, right? They're all playing a role in each other. We know in fight or flight mode, where we're constantly dumping adrenaline and it's converting to cortisol, that's playing a role in chronic inflammation and stress. It also is playing into these brain neurotransmitters. So how does this really relate back to treatment, right? Well, a more holistic approach to treating depression is also going to trickle over to looking at root cause and how it's maybe interplaying with other health issues we're facing rather than separating them out or referring to everything as psychosomatic. If we start to incorporate behavioral activation and brain retraining and supplements and different diet and movement and being in nature, we start to see this engagement in higher reward activities that keeps us going, and we start to see the bigger picture to come together. And I think it's going to help this evolution of how we view mental health and how we view the connection between the mental and physical healing that we're looking for. I also think it's really interesting the more that we learn about autoimmune encephalitis. I've been reading a lot recently about this idea that, you know, the long-term idea of toxicity in our environments, the idea of so many of us that can identify in the brain retraining community, it all started with mono, it all started with Lyme, strep, with mold, with a head injury, with, a trauma. Autoimmune encephalitis has been very underdiagnosed, but there are a lot of researchers that are thinking that it affects more people than we realize. This is a neurological condition where your body's immune system mistakenly attacks healthy brain cells and leads to inflammation of the brain. And this can lead to a whole bunch of neurological, physical, and psychiatric issues, and it mimics a lot of other medical conditions. So some of the causes here can be autoimmune response caused by other physical issues, infections, cancers, other autoimmunity issues, things like viral infections, bacterial infections, different types of cancer, traumatic brain injuries. And autoimmune encephalitis is very diverse. It can look mild or severe. We are seeing more doctors ordering things like the Cunningham panel, different autoimmune marker testing to see what antibodies are in the brain. There's even a test from Vibrant America Labs called the Neural Zoomer. It's very similar to a Cunningham panel. You can actually order it to have it done at home, and you're getting this really robust idea of what type of inflammation is in your brain at any given time. Usually doctors will want to follow that up with things like MRIs, CT scans, maybe even spinal fluid testing to see if those antibodies are at the range that they look like they are from the initial blood work. And this is also going to go along maybe with EEGs or other history and physical information your doctor gathers to make sure that everything is lining up for this type of diagnosis. But I find it really interesting because autoimmune encephalitis can present with cognitive impairment, memory issues, confusion, memory loss. It can look like Alzheimer's disease or dementia. Psychiatric symptoms like mood swings, hallucinations, aggression, paranoia. It can look like bipolar or a psych issue. Seizures and epilepsy. It can mimic epileptic disorders. You can have movement disorders. It can look like Parkinson's or MS. And autonomic dysfunction, irregular heartbeat, unstable blood pressure, sweating. It can look like POTS syndrome. So what I find interesting is so many people that I work with in the chronic pain and illness community come in with this huge array of diagnoses, right? It's EDS and TBI and Lyme and POTS and epilepsy, or like all of these things. And I think it's possible that they do have all of these diagnoses, but are we missing a greater underlying issue like brain inflammation, which interplays between toxic environmental triggers and chronic limbic system dysregulation leading to overproduction of adrenaline and cortisol, causing brain swelling, which is then causing a mix of psych and physical symptoms. And they are kind of being painted by the medical community as a hypochondriac, or, oh my gosh, how do you have this many symptoms? Or, yeah, you have all these different symptoms, let's send you to 20 different specialists to treat them separately, rather than looking at maybe a root cause of an actual brain inflammation or an autoimmune issue that we could be treating and resolving multiple symptoms at once. So what's really interesting is there are some holistic approaches to autoimmune encephalitis, but they have to be done in conjunction with Western medicine approaches. So with Western medicine approaches, you are going to see things like IVIG, steroids, antibiotics, low-dose naltrexone, although that's kind of debatable. That's an immune modulator, and you're going to find some Western medicine doctors that think it's helpful and some that don't. When we're including holistic approaches, we're going to look at anti-inflammatory diets, a healthy gut microbiome, because our gut is our second brain. There's a link between that blood-brain barrier and our gut, and how we can maintain a healthy microbiome to also support our brain. It's like 80% of our serotonin is produced in our gut. They're all related. And maybe doing elimination diets to cut down on specific allergy foods or trigger foods. We can look at physical therapy, mind-body practices, meditation and mindfulness, yoga, biofeedback, things that can help us manage the neural pathways in our brain and soothe our limbic system. A lot of naturopaths will also suggest things like omega-3s and vitamin D and turmeric, things that are anti-inflammatory and supportive of brain health. And getting enough sleep is also super important. We want to reduce our environmental exposures and really work closely with a team of both Western and holistic doctors to help us as we're healing. From the brain retraining side, it's interesting because neurofeedback is going to implement actually seeing like brain waves and how the use of real-time coping skills, you can see in the brain activity how we can adjust neural patterns and stabilize mood. When we use cognitive behavior therapy, positive self-talk, using our mantras, using our brain retraining rounds, mindfulness and meditation, they're all working together to help us as we heal, to encourage further neuroplasticity. And we want to work with anything we can to reduce inflammation, to help us manage our symptoms, and just improve the functioning that we have. So I wanted to just talk about this. I know it's a really complex issue, but I find it to be something that is coming about more and more. And do I think necessarily that this is a new diagnosis that every single person has? No, not necessarily, but it's very interesting to me that it's something that is not often explored, and it's probably more common than we realize. We do understand the role of inflammation. We understand the role that the brain does play a central role in a lot of these issues. Neurotransmitters play a role. We also know about triggers and toxins in our environment. The idea of autoimmune encephalitis as a growing diagnosis could be just that we're testing more for it. Maybe it's always been an issue and we just never found a lot of the cases because we weren't running regular Cunningham panels and the associated testing that comes along with it. But I think that in a world where we're exposed to more and more triggers and infections and toxins, and seeing more and more people with chronic illness and chronic mood issues and chronic pain, we need to be exploring a little bit deeper. And this all goes hand in hand where someone might come in the door. This is why I started with this book that I had started talking about at the beginning of the video. Someone might come in your door as a provider or be talking to you as a friend about their depression and the behaviors and the feelings they're having. Rather than narrowing that down to just treating that with a drug or just saying, well, that's your serotonin, we need to be looking deeper. We need to be exploring how neurotransmitters form in the brain, what supportive factors go into this, what behaviors go into this, and how inflammation or autoimmune conditions that also can impact our brain and cause other chronic illnesses and chronic pain issues can relate to the development of depression and anxiety and psychiatric symptoms. And the longer that I work as a mental health therapist, I've worked in the hospitals, I've worked private practice, I've done home-based work, I do medical social work, I've done just regular therapy with people, and my niche recently is people with mystery illnesses, complex illnesses, and brain retraining. I really think that our medical industry does a disservice when someone comes in with full picture symptoms and they're trying to present this to these doctors, and they immediately are like, well, go to neuro for this, and go to gastro for this, and go to dermatology for this, and I'm not going to touch any of this, so just go to these specialists. And the specialists, well, everyone's well-intentioned, they're afraid to step on each other's toes, and they're chasing down these diagnoses that make sense in the little snapshot they have of, oh, my stomach hurts. All right, well, let's waste a bunch of time and money doing these tests when we're missing the full picture. Why aren't we looking more at root cause? Why aren't we looking at the whole person? And don't even get me started on the doctors who don't even try to send you to a specialist, and they just say it's psych, and they throw you into counseling or psychiatry. So we need a more robust integrative approach. Holistic medicine doesn't just have to be, oh, it's herbalism and woo-woo and yoga. Holistic medicine can incorporate Western medicine, but you're looking at the whole body, the whole person, the whole system, the environment. And I think this is a really important thing that we need to touch on more in our society and advocate more for ourselves with our doctors and our medical providers. I hope this was helpful to anyone who's dealing with any sort of depression or anxiety on their healing journey, and to maybe open up some discussion with your providers and thinking a little bit deeper about how your physical and mental health relate. I hope you have an amazing day full of healing, and I will talk to you all soon.